Thank you. Good afternoon. Thank you for having Susan and I here today to talk about our current nursing shortage and our predictions for the future, and more importantly, what Beacon is doing to help that situation. The nursing shortage is not a new phenomenon. In fact, it began long before the pandemic. There are many factors that have led to that situation, some of them intrinsic to the system and to the profession, and some of them extrinsic and exacerbated by the pandemic. More, a lot of changes to the role of the nurse. There's been a migration to other work environments besides just bedside nursing care. There's lots of opportunities for our nurses today. There has been also a migration towards advanced practice, and many of the nurses leaving the bedside to pursue higher education, which leaves us less to work with in our clinical situations. A lot of the changes to the nursing role have also created a lot of pressures for the nurse. The implementation of computerized records, a lot of angst with some patient interactions have led to a high degree of burnout with our nurses as well. In fact, a recent survey by Career Builder identified that almost 70% of our current nurses identified as being burned out. There's a lot of significant demographic and population factors in play as well, leading to increasing demand for qualified providers. The system was already significantly strained when COVID hit, but COVID really just exposed every crack that we had and has really decimated the situation. Changes to the nursing role have contributed to what we're dealing with currently. As just stated, there's a lot of opportunities for our nurses. We currently have about 4 million nurses in the United States. Historically, nursing functions have focused on caretaking, but that role has evolved considerably. Today, nurses can be found in many diversified roles where they are valued for their clinical knowledge and their expertise. One thing that has not changed, however, is the fact that nursing has consistently ranked as the most trusted profession for over 20 years running. While the majority of nurses in the United States continue to provide bedside care for hospitalized patients, their role and opportunities has expanded significantly. Clinical areas the nurse really is crucial for. They provide the role of the caregiver, the communicator. They provide education to patients. They serve as an advocate for the patients and really a liaison between the patient, the family, and the rest of the care team. They also, during COVID, filled a very vital role as friend and often family when restrictions due to the pandemic prevented other caregivers or family members from being present. The nurses have also, however, migrated into some non-clinical roles, including manager, leadership. We have nurses that are filling case management roles. They serve as patient navigators. They serve on utilization committees for review with insurance companies. They are clinical documentation specialists. They do risk management. So lots of competition for the nurse, because there are so many opportunities available to them that there's just endless places where they can devote their skills. Changes to our population have also contributed significantly to the shortage and are leading to significant increase in healthcare demand. Currently, our population is aging very rapidly. About 10,000 baby boomers will turn 65 every single day. Currently, people 65 are outnumbered. By 2035, they will outnumber the entire population of 18 and older. So most people who are 65 or older have at least one health condition. Most of them have multiple, and many of them are living longer with these health conditions, which leads to an increased demand for the services that the nurse needs to provide, increased need for hospitalization, increased doctor's visits. So there's just going to be more and more need for the nurse as we move along. So all of these demographic forces are resulting in a dramatic increase in the demand for nursing. Current estimates suggest that we need 1.2 million new nurses by 2030. Combine that with the fact that 43% of our current nurses are considering leaving because of the stress and the strain that the pandemic has brought on, as well as other factors. Obviously, we need to educate and train and get more nurses into nursing programs. The other problem is that we don't have educators. So nurses need to be educated by nurses, and we don't have enough of them to fill that role. So last year, in 2019, there were 80,000 students who wanted to enter a program to become a nurse and couldn't because we did not have a program for them. There wasn't an educator, there wasn't an open spot. The same demographic forces and factors that are affecting the rest of the population are also affecting our nursing population. So they're also getting older. In fact, 55% of the current nurses are now 50 or older. 62% of those nurses are considering retiring within the next 3 years. Our local situation mirrors local trends. Currently, there are over 150 vacancies through the Beacon Health System for nurses. Regionally, that number is over 1,000. Because of growth, the population demands that we just discussed, new buildings and new care that will need to be delivered, we estimate that Beacon is going to need 1,250 nurses in the next 5 years. Regionally, we graduate about 365 nurses a year. So clearly, the supply is not enough to meet the demand. And the competition for that talent is going to be fierce. We also expect that turnover is going to be a significant factor. Historically, about 17% of nurses would exit their job over the course of 1 year after being hired. In 2021, that number increased to 24%. Many of these nurses left for higher paying travel nurse positions. And we really saw the pandemic accelerate that and just cause a really big problem with the growth of the travel industry. So 35% increase in the number of travel nurses from 2019 to 2020. And again, the nursing population getting older, 62% of those 50 and older planning to retire within the next 3 years. All of this combining to what is really looking like a perfect storm for the nursing crisis and our need. So I'm going to turn it over to Susan. So to have some good news here. So we want you to know what Beacon is doing to address this. We're aware of it, we're feeling it, we're living it, and we want to do something about it, hopefully with your help.
So I'm here to just share, when we were looking at our nursing challenges within the health system, this has really been a journey for us as a health system, and we're not really stopping where we are right now, but we want to share with you a couple of the tactics that we put into place. So right now you see up here, we have kind of 4 different strategies. The most obvious one, which I think we're all dealing with within the county, is a labor shortage. So we immediately started looking at pay increases and bonuses. But knowing that that wasn't really going to solve our problem, seeing that the number of nurses and how short we are. So this year, we started a new partnership with Ivy Tech, which we're very excited about. And this partnership is really, it was very intentional. And I get the question a lot, why did you choose Ivy Tech over another university? And I always answer it that we started with Ivy Tech, and we're certainly exploring other opportunities with other local universities and schools as we move forward. But we're really piloting this program at Ivy Tech. And the idea behind it and the intentionality is that we do know that 90% of all Ivy Tech grads stay here in our community. So we wanted to partner with a school where we'd be educating nurses who are going to stay here in our community. We also know that over 40% of all Ivy Tech students represent underrepresented minority populations. And we really wanted to address those communities for 2 reasons. One is we wanted to make sure we had nurses at the bedside who were reflective of the communities that we live and also reflective of our patients. So we wanted to increase the number of minority nurses at our bedside. The second reason is that nurses, it is a pathway for those first in college, first in their family to go to college, to receive a higher education, which is then lifting up the economic prosperity of those communities. So that was another reason why we decided to partner with Ivy Tech. So then this initiative is really to create a Beacon Nursing Scholars Program at Ivy Tech. So students who apply and want to go and get their associate's degree, their ASN in nursing, are able to do so at Ivy Tech free of charge. So Beacon will cover tuition, books, fees, in addition to the clinical exams that they need to take in order to become a nurse, as well as like the Kaplan study exam. So it really is an all-inclusive free education for students who are interested in becoming nurses. In addition, we are providing a living stipend to those nurses. So each semester they'll be receiving a living stipend while they're at school for those 2 years. When they graduate, we ask that they come work at Beacon and work with us for 5 years as a way to give back for the education that they received. In addition, though, as Michelle, Dr. Beish had mentioned, we have a problem with turning students away. Ivy Tech currently only has 80 openings for nurses. So we also worked to provide what we call our hybrid nurses. So we brought nurses from the bedside who will now be teaching at Ivy Tech so they can increase the number of students that they have. Because originally when we had that conversation with them, we said, hey, why don't you just, double or triple the number of nursing students that you let in? And they explained that they simply didn't have the faculty. So we're also providing the faculty to them. Our goal is to grow the program by 50% over 5 years. Certainly, it's not going to address, as looking at some of those numbers and the needs within our community. This isn't a quick fix, but that's a program that we're piloting and we're hoping to continue to expand. The other piece that we're looking at is what we call our Grow Our Own nurses. So this is something that the foundation is looking to do. We fund a lot of scholarships to individuals within our health system who want to continue their education. But in particular, we're doing $1 million endowment for Elkhart General Hospital nurses. And the idea behind this is that we have a lot of entry-level positions, patient care assistants, licensed practical nurses who want to continue to go on with their education. These are often single moms. They don't have the resources to be able to go back to school. So we provide not only tuition reimbursement, but additional scholarships to allow them to go back and get their nursing degrees. So we're also trying to build up our nursing program from within our current workforce as part of our workforce development plan. And then the last area is our high school internship program. We've always dabbled a little bit in our high school internship program, and we're just starting to put a lot more thought and resources into this. But to really start talking to high school students about pathways, careers in in healthcare. And this isn't just careers in healthcare related to nursing, it's also careers in healthcare related to respiratory therapists or radiology techs, phlebotomists, pharmacists. So as we continue to look at this program and kind of build it out, we'll continue to have more opportunities for high school students in our region to be able to start interning, perhaps get a job at Beacon, perhaps then pursue either a degree in nursing or take advantage of scholarship and tuition reimbursement to continue their educational opportunities. And then the last slide is just a brief thing on the endowment, which is really just planting a seed in Elkhart to allow for 8 to 12 scholarships per year for those Beacon associates who want to continue to go receive their degree in nursing. So I'm going to invite Dr. Beisch back up here for questions, since I'm sure you probably have a few questions for her or for myself. We covered it all? That's great. Yeah.
I'm just curious, if you have a successful program with Ivy Tech, can you reach out to the other higher education institutions in this area that have nursing programs, for example, IUSB, Goshen College? I'm not sure Bethel University.
Yes, it does.
And offer the same kind of a program, or
yes.
Are you running out of funding?
Well, it's partly a funding. It's a $3 million a year investment for us to do the Ivy Tech initiative. We have started talking to some of those other universities and seeing what we can do, and in particular with IUSB, because it has the bachelor's nursing program, so they're almost the connector. So for those nurses who receive their associate from Ivy Tech, they're employed at Beacon, but they have a requirement to get their bachelor's within 5 years. So we're already going to start needing to create a pathway for those Ivy Tech associate degree nurses to continue on, and Ivy Tech is a natural place for them to land. But yes, we talk to other universities and look at places where we can partner with them as well.
How active are you in the school systems in Elkhart County, encouraging young people when they're maybe in 8th and 9th grade and they're getting counseling or college prep or skill training or whatever, where they're actually being introduced to nursing?
Not as active as we want to be or should be, and that's part of our internship program, is really looking at that and being much more intentional. So partnering with our career centers, partnering with the high schools to talk to them about career pathways, also getting them internships or jobs within the health system while they're in high school. So that's something that we're just getting started on, but know that that's something we need to be doing as well.
Two-part question. 3 schools were mentioned: IUSB, Bethel, Goshen College. What other institutions of education in the community area provide nursing programs, and how many years do you have to go to get the degree?
Yep. So the question was related to what other nursing schools are there in the area, and how long do you have to go to school to be to get a degree. So an associate in nursing education, which is the minimum to be a bedside nurse, is a 2-year program. But ideally, we want our nurses to all be bachelor's trained, which is an additional 2 years. In terms of other schools, Shannon, I'm gonna, we have Southwest Michigan, Bethel, Goshen, Ivy Tech, IUSB, St. Mary's, and Andrews University. So 7 universities within kind of the region that provide either associates or bachelor's nurses.
I'm kind of curious about this issue with the traveling nurses. Is that going, as COVID hopefully winds down, maybe, is that going to burn itself out, or is that going to continue to be?
So the question was about travel nursing, and do we see that situation continuing or perhaps winding down as COVID improves? Yes, we do see it as improving. but it won't completely go away. So even before COVID, we relied on travel nurses from time to time. And we would have, say anywhere around maybe 40 travel nurses at Elkhart Hospital filling roles, vacancies and things like that at any one time. That number really increased because of COVID. And as a result of that, the number of requisitions for these travel people across the country really exploded. And supply and demand being what it is, we also saw the rate go up a lot. So thankfully, we are seeing that come back down as the demand is decreasing, but we're still not back to anywhere close to where we were pre-COVID. But hopefully, it will continue to get better.
Good, go ahead.
So it strikes me that the skill set to be a nurse is like oncology, surgery, emergency room, they're all really different. Is that all part of the curriculum, or do you have a whole lot of on-the-job training after?
So the question is about the training for nursing and how much of it is on the job specialized training versus how much do they get in nursing school. And the answer is, they get the basic education as part of their nursing education, and then there is a whole lot of on-the-job training that also occurs. So, it used to be that we wouldn't put new grads in places that were really intense and specialized. The emergency department was a place that, we used to not take new grads in the ED. Just because it is your breadth of knowledge, things you need to know how to manage is pretty huge. And the same for the ICU. Now we do take new grads there, and there's a lot of investment. So, you spend a lot of time training them, getting them to know what they need to know so that they can be proficient, at their job. So that's where that turnover rate also really hurts us, because, if you spend all that effort training somebody and then they leave within a year and you're right back to square one, it's really challenging. So retention is also, very huge for that reason. Yes.
I've heard you mention the overwhelm of all the nurses and then how that does with retention. Do you have anything to support them in managing their own self-care and moderating that sense of overwhelm to help them retain it?
Yeah, so the question is about what we're doing to support our current nurses, deal with the trauma of the pandemic and just the demands of the work. And yes, we are always looking for opportunities, looking for things that we can do. I mean, through Beacon, we have, employee assistance program to help with people who may, mentally be really strained and stressed. We have done things like we had a donation that we were able to buy what are called sleep pods, rest pods for our nurses that were deployed places around the hospital that just provide an opportunity for them to, unplug and maybe, decompress for some time. A lot of it comes down to staffing ratios too, to be honest. The pandemic, because of the demand, because of the severity of the crisis that we were dealing with, we really did have to push our nurses to expand the number of patients that they were managing. Because when somebody comes to the hospital, we can't just tell them we can't take care of you. In the pandemic, there was no place, every hospital was in the same situation. So we really had to dig deep. We had to dig deep for a long time. And, we're trying to get back towards our more historic staffing levels so that we're giving the nurses, the ability to provide the best care that they can and do everything that they want to do. Yes.
What is the average traveling nurse per hour?
Well,
Over
so we were up to 200 an hour for a traveling nurse. Currently, I think the last requisitions that we sent were probably, and Carl, maybe you know, like 120, I'm thinking. Yeah, 120. Pre-COVID, our travelers got around 60 an hour. So you can see what, I mean, just imagine, like our nurse is our biggest category of employees. We have more nurses than anything. And then
Right, your average nurse average nurse, not travel, is receiving what now?
So we did a big pay increase with contracts for our nurses. And so a new grad right now through Beacon can start at $50 an hour for a new grad. That's a big increase from where they were.
Is the 40-year in the ICU getting more than $50
Yes,
an hour?
yes, it's all based on years of service. Mhm.
So average nurse pay now an hour is what? Not travel.
$58. The average nurse is 58, and that but it fluctuates between 50 and a little higher.
And years ago, the decision was made to not utilize licensed practical nurses. Since the need is actually bedside in part, is there any consideration for
Yes.
changing that viewpoint?
So the question about utilization of licensed practical nurse LPNs, yes, we do recruit. We do have positions for LPNs. They have also been surprisingly difficult to recruit and hire. So, you know, there aren't a big access of them either, sitting around looking for work. So it didn't provide us as big of a boost as we had hoped it would.
An online question, sorry to jump in here. Is the need greater for bedside versus office or technical techs?
Yes. Yes, the need is everywhere. So, you know, the question about is it more bedside, is it more office? So, you know, one thing that we saw when the pay rate was increased for the bedside nurse, and we boost that rate quite a bit, is it really did put a lot of pressure on the offices. So we still need nurses in the office space to deliver care there as well. So we can't, you know, just route Peter to pay Paul. We have to, you know, make sure that we have nursing, you know, staff everywhere. And we also know that our, you know, our friends in long-term care are also really struggling with this issue as well, with the lack of nursing.
What's the ideal bedside ratio and maybe versus what you're having now?
So the ratio for a nurse, it's going to depend on the acuity of the patient. So some lower intensity areas, observation patients or general med surg, generally an accepted ratio would be somewhere around 1 to 4 or 5. And take that to the other extreme, which we saw a lot of just very, very sick COVID patients on multiple drips, on a ventilator, maybe even receiving ECMO. That's going to be a 1-to-1. You get one nurse for that patient. So it's a whole range depending on the acuity of the patient. Yes.
Do you see many nurses leaving one institution to go to another institution based on salary?
So the question about kind of migration of nurses within the region to different hospitals or different health systems based on pay. Yes, that does happen. And we know that all of the systems within the area do try to be pretty competitive. So if one does something and you know, at Beacon we did, you know, act, you know, fairly quickly and got our, you know, pay grid out there, but it wasn't very long before, you know, the other local hospitals and health systems followed suit. So we're all within a tight range, but you know, there are people who will leave for, you know, $2 or $3 an hour. Yes.
God forbid if we have another pandemic, but anyway, with that in mind, what are you doing to prepare just in case we have another situation that we just basically come through?
So the question about another pandemic and what we're doing to prepare, we will have another pandemic. I think there will be another, I don't think we're done with COVID. So, we are trying to do everything we can to reinforce our staff to make sure that we have enough, resiliency in the system that we can react when the demand is there. So that was some of the problem going into the 2019 pandemic, is that already the healthcare system was already pretty stressed, and we were running very lean. And so when you're running very lean, there's not a lot of ability to ramp up very quickly, especially when you're talking about highly trained and highly skilled and highly educated professionals, so nurses and physicians. So, this is what this is all about, is trying to build up so that we are ready, because I think it's inevitable.
We'll take another, we'll do questions after, if you're willing to hang around.
Sure.
Thank Michelle, Susan, thank you very much. Both Michelle and Susan will hang around for a few for extra questions. And I also wanted to make sure we got Shannon Oaks introduced, because I don't think she really did. And Shannon's with the foundation. If those of you in the not-for-profit world may know Shannon from her time, many years at the Community Foundation as well. So thank you also for joining us. Jim Rickoff, you have a thought to mention?
I just wanted to say that Shannon was the conduit between Rotary and Beacon, and this presentation exceeded my wildest expectations.
So,
I'm going away very optimistic.
I don't know if you could just, sorry, Jim, I wasn't sure what you wanted to say, but I did recognize that she had not. Thank you for doing that, and thanks for getting it set up. Everybody, thanks for being here today. Sorry for the little glitches. Thanks for working with it. Thanks for those of you who are joining us online. I apologize. Hopefully, Andy will fill in the gaps, and at least we got the presentation, because there were some frightening statistics up there. The number of old people and the number of nurses getting older who are leaving. That was as quick as I could, briefly as I could say that. I also want to say, Doug Putnam, thank you for 58 years. It took me, it took 20 minutes to sink in. 58 years you've been a member of this club. Your contributions, thank you so much for helping pave that, and thank you for still being a part of this club. We appreciate that. Everybody, draw inspiration from Doug Putnam and stick with it. And Shan, thanks again for coordinating our 50+ year club. Everyone, thanks for your service in the community. Have a great rest of the week. Rotary's adjourned.